morning. First of all, on behalf of Mayo Clinic, let me tell you that we are really excited to be here today. I've been at Mayo for my whole career, and I can tell you that if you ask employees at Mayo what Mayo is all about, you will consistently hear the needs of the patient come first. Because the needs of the patient come first, Mayo Clinic is committed to offering more people and communities access to Mayo Clinic knowledge and expertise, allowing patients the benefit of getting the best possible care, and often while staying at home to receive that care. This commitment has resulted in us forming the Mayo Clinic Care Network. Through the Mayo Clinic Care Network, Mayo Clinic collaborates physician to physician, caregivers to caregivers, interested in working together in the best interest of their patients. Our goal is to identify high-quality, like-minded, culturally like-minded organizations with whom we can affiliate through the network. Sparrow is obviously a recognized provider of high-quality health care, and like Mayo Clinic, Sparrow is focused on providing integrated, patient-centered care. Mayo Clinic and Sparrow have a shared purpose of bringing the highest quality medical care to the mid-Michigan region. With Sparrow as the newest member of the Mayo Clinic Care Network, I'm pleased to announce we are formalizing a relationship that recognizes our mutual goal to allow physicians and other caregivers to collaborate, working together in the delivery of care to patients and their communities. As we embrace this new relationship, we are all very excited to see what the future brings for Sparrow, for the Mayo Clinic, and especially for the communities that we are so very privileged to serve. We're excited. Thank you very much.
Thank you, John. Welcome, everybody. I'm grateful for the opportunity to be part of today's announcement. This is a huge step forward for all of us in the community and indeed the region. 1 year ago, we traveled to the Mayo Clinic with our Sparrow team, led by Mr. Swan, looking for new ideas to do things better for our patients. As we worked together, we found that we shared values. We had shared values, shared purpose, and shared goals with our colleagues at Mayo. Our missions are patient-centered. We're excited about the collaboration between our organizations that continues to deepen to the point where we are joining the Mayo Clinic Care Network. This is an endeavor that will help our entire team be better doctors. It will help our nurses be better nurses, our administration to be better administrators, and our over 8,000 caregivers and staff, but most importantly, it will help our patients first. It's a stake in the ground for quality and puts our patients and their families at the heart of all we do. I'd like to now introduce a video to you that speaks to our excitement and our enthusiasm and real commitment to this relationship between Sparrow and the Mayo Clinic. So can we do it?
You've already begun to hear about sort of the who, the what, and the when, and the why about this announcement. I'd like to give you a little additional insights into the why. And I can tend to be a little verbose at times, but so I've actually though struggled with our being able to articulate, I think, the incredible significance of what the membership in the Mayo Clinic Care Network would be. There isn't really time enough today to outline all of the reasons why this network will be profoundly important to patients, their families, the communities we serve, but our physicians, nurses, staff, board members, volunteers. It's also a little unusually difficult for me to express how much we appreciate the way we've been treated by every Mayo leader we've been in contact with since day number 1 and throughout the entire process. I can say that to a person, the caliber of each member of the Mayo team is impressive, extraordinary, and it's definitely to be admired. I'll simply say there are 2 fundamental reasons why we're becoming a member. They are quality and the patient experience. You know, there's a Mayo way of caring for patients and the whole person. There's also a Sparrow way. At Sparrow, we promise to deliver care, quality care, and a memorable patient care experience to every patient, every time, no exceptions, no excuses. At Mayo, the needs of the patient have always come first and have been a primary value for Mayo since it was first articulated and, more importantly, practiced by Drs. William and Charles Mayo. We at Sparrow share that vision, that aspiration, and that commitment. Dr. William Mayo, in an address to Rush Medical College in 1910, expressed it beautifully. The best interest of the patient is the only interest to be considered, and in order that the sick may benefit of advancing knowledge, union of forces is necessary to develop medicine as a cooperative science. Our decision to join the Mayo Clinic Care Network is based on 4 fundamental beliefs. One is Mayo's patient-first philosophy. If you visit Mayo, it's palpable. 2, Mayo's commitment to treating the whole person. They're dealing with a person who happens to have an injury and illness, not necessarily treating just the injury or the illness, they're treating the whole person. 3, Mayo's track record in showing that patients directly benefit when physicians, nurses, and we like to think like-minded organizations demonstrate patient-centered teamwork and cooperation. And 4, the shared value that care should be delivered as close to home as possible, because that's what patients would like to do. At Sparrow, to put it mildly, we're rather intense about always improving and striving for perfection in the way we deliver patient care, and in believing that each person deserves to be treated what we call here radical loving care. Radical loving care principle is every patient, every visitor, every caregiver deserves to be treated with dignity, courtesy, kindness, and respect. Again, no exceptions, no excuses. So with extremely high aspirations and considerable humility, we seek to earn and sustain national recognition for quality and patient experience. We do so for the patients, we don't do that for us. But we believe we do so now by learning from and working with the finest, most admired healthcare organization in our field. The Mayo leaders here today like to say, think big, start small, move fast. Well, we've taken that message to heart. Although I'd have to say the Mayo Clinic Care Network membership is Sparrow thinking big, it's moving fast, but it's far more than starting small. Our membership begins with key services that are going to help patients, direct benefit to patients, physicians, nurses, staff. But we envision tremendous potential for other future collaborations. Sparrow's relationship with the Mayo Clinic Care Network is expected to continue to grow in the years ahead of us. We're confident about that because of the countless examples we've already experienced of the quality, the professionalism, and the caring spirit of Mayo Clinic Care Network team members, led by Dr. Hayes, who you've already met, Mary Jo Williamson, who is here. Mary, if you'd like to stand up, Mary Jo, and wave and be recognized. Thank you very much. Eric Clavetter, who's been just a pleasure to work with. Eric, please stand and wave as well. And of course, Shirley Weis, who will be up here shortly, who Dr. John Noseworth, the Mayo CEO, has described simply as the best chief administrative officer, period. And that's saying a lot. We believe that's true too. Once again, thank you all for joining us today for this announcement and for this celebration of the exciting new chapters we'll be writing together in Sparrow's long and distinguished history of service to this region.
Yes, I want to be here to add our congratulations, our commitment to partnership with you as you begin this new work with Mayo. I also want to sort of go back to Shirley and I had a drink last night, as we often do. She's a great MSU alum, and she was well trained by Dr. Clark and Dr. Gibbon, who are in the front row, and a product of Michigan State University and Sparrow Hospital. So it's interesting we've come in many ways full circle. And we had a conversation probably 12 years ago when Shirley was beginning to be the rising star at Mayo that said, what can we do together? Because much of the values of Michigan State University, of what she learned at Sparrow as a beginning nurse, represented what she had been trying to do and the values of Mayo, and why she was excited about being part of Mayo. And we concluded that we needed to be ready to do that. And we weren't ready at that time. And through Dennis, through your work, the Sparrow Way project, we are now really more than ready to engage in this partnership in new and exciting ways that will benefit the community and Michigan State University. And I think our horizons are really unlimited for this community. And I want to thank you publicly for the leadership that you provided to permit this moment to happen. So thank you very much. our work around children and the collaboration on our practices is one step of a very small way to think about what it means to be a Mayo partner in the Sparrow way. The announcement around the Center of Innovation was really critical to this evidence-based work that will permit Sparrow, Michigan State University, this community, to not simply be a receiver of information with Mayo, but a provider of information and an important part of a network that shapes the quality of care. And that's really, I think, one of the things that Shirley has done, Mayo has done, is be great listeners, not simply great providers of information. And we really are excited about the Center for Innovation. And though it's not always all the I's are not dotted and the T's are crossed, I think, Shirley, you'll be really pleased to know that your mentor, Barbara Gibbon, is going to be our initial director of that center. So, Barbara, thank you very much. We have great confidence in Barbara. She's been a leader for us, that immediately we're going to have a values integration of the work we're going to be doing at the Center for Innovation and what you're trying to do at Mayo in ways that will position us to not only sort of start small, but again, be very fast and quick as we can move this new network forward. This is just an exciting day for the community. We're looking forward to how we're going to be able to be a small player in the Great Sparrow Way and the Mayo Partnership in a way that makes this area, this community, one of the beacons of health.
Well, greetings to all of you from the Board of Trustees of Mayo Clinic and from our President and CEO, Dr. John Noseworthy. We are thrilled to be here today and to be able to announce this great partnership between Sparrow Hospital, the Sparrow Health System, and Mayo Clinic. This is really a dream come true, and it's a dream come true in terms of our commitment to patients. As you heard from Dr. Hayes, this is just a step in development of a network of like-minded providers across the country that we think will make a real difference in healthcare delivery for our country. As you know, we're very much in a state of flux as healthcare delivery and reimbursement is under scrutiny and really redesign as we are moving forward in our world. And we think that this network that we're developing is going to be so important to, again, find those other like-minded providers that are exquisitely patient care focused, that have made a real difference historically and have the vision for the future to be putting the needs of the patient first. Because we believe that there are so many challenges ahead of us in healthcare, and we need to all work together. That union of forces that has been discussed is so important for us. And so for me personally, it's wonderful to come home and see so many friends and colleagues and folks that I've known for many, many years. But I'll tell you on a personal level, the reason this is even more important is that my family still lives here. I have friends who still live here, and even though I don't get back to Michigan as much as I like, it's important, and I just am so thankful to know that we now will have this relationship to have even better care, to bring those care delivery models, to be able to focus on the needs of the patient, so that when my father, my sister, and my cousins, and my friends call and say, where shall I go? As we've said for over 100 years, you need to go to Sparrow, and if Sparrow can't handle it, then you need to come to Mayo, and we'll all work together. So thank you so much. It's a pleasure to see you all. We look forward to wonderful things to this joint effort of Sparrow Hospital System and Mayo Clinic. Thank you very much.
And I would like to pause and see if there's any of our local media who have a question.
Steve Carmody with Michigan Radio. I think I understand the tangible benefits that Sparrow gets from this relationship. What are the tangible benefits that the Mayo Clinic gets from this relationship?
So the question is, what are the tangible benefits that the Mayo Clinic get from this relationship, Dr. Hayes?
The tangible benefits for Mayo Clinic is that this extends our reach, again, to other organizations like Sparrow that are very high-quality organizations in the United States. By extending our reach and starting to form this network, as Shirley Weis described, it gives us all the opportunity to elevate the level of healthcare in the United States. Now, is that tangible to the Mayo Clinic? Actually, it is, because our best interest is the best interest in healthcare in the U.S. and for everybody else. So it may be difficult to see how that's actually tangible, but in the long run, with all that's going on in the healthcare landscape right now, this, for us, is a really very important new initiative.
Just a follow-up, does that mean you'll be working grant-funded research through Sparrow, or is there something that you'll be able to do with this relationship that you wouldn't be able to do otherwise?
Well, certainly by formalizing, the question was, are there things that we'd be able to do that we wouldn't otherwise be able to do with Sparrow? Certainly we've had friends in this organization historically, but by formalizing the relationship, we have the opportunity, and we've seen this with other care network members, for that relationship to become much stronger and much broader. It's starting around clinical activities, so where we can provide help locally to the patient. If the patient should need to be referred, we would be delighted, obviously, to see those patients in Rochester or on our campuses in Florida or Arizona. Eventually, we see additional offerings through the network. Right now, there are some around education. There will be more around medical education, and also other offerings around research.
Thank you. Do we have another question?
Yeah, WIL, Anthony Sabella with WILX Channel 10. Why did you guys decide this was a good move now? Why now?
Dennis, would you like to take that question?
Well, for us, we see, you talk about healthcare reform, and people believe that's supposed to emanate from Washington, D.C., or maybe even from Lansing, Michigan, the capital. We think marketplace reform is really what needs to go on, and what we're talking about is people today are generally concerned about safety, quality, satisfaction, and value. When you want to look for a name in healthcare that bespeaks quality in the patient experience, you look at Mayo. So it was a very easy and obvious choice for us, and we were able to pass the rigorous due diligence process required to qualify, and without hesitation, our medical staff and our board are totally with us, and we've been happy with this right now. Thanks.
Yep, thanks.
Question for Dr. Hayes. Kevin Lavery with WKR Public Media at Michigan State University. Obviously, Mayo Clinic has an international reputation, international reach. Does that mean that Mayo has access to perhaps medicine providers, research streams internationally that perhaps Sparrow does not have? What's really the overreaching benefit because of Mayo's international reputation?
Most research actually is conducted within our 3 campuses, and we're looking from a research standpoint to extend that. Internationally, we have a strong network of alumni throughout the world. The Mayo Clinic Care Network will eventually have a presence internationally. Specifically from a research standpoint, and the question that was asked previously, we certainly see the possibility of extending clinical trials and other clinical research throughout the network. If regulatory issues allow, we would extend that internationally as well. But again, I think that the international breadth of Mayo and the fact that we will be doing more in the international arena in the future with the care network will again strengthen all of the organizations. It's really strength in numbers.
Okay, at this time, I'd like to know if there are any questions from the media who are participating on the conference call. If you could, please state what media you're from and your question.
I'm Pat Anstead with the Detroit Free Press.
Thank you, Pat. Go ahead.
Can I go ahead?
Yes, go ahead, Pat.
Would you let us know if there's any money attached with this relationship? Did Sparrow have to pay to be part of the network, or will Mayo be part of any construction or new spending here?
Dennis Swan.
So this is Dennis Swan, and what I'd like to say first, I want to make sure we're clear. For all of the consultations that we're talking about, and the access our physicians are going to have to Mayo physicians, there is no charge whatsoever to a patient, and that's really important, no question about it. In terms of the arrangements here,
Went through with the Mayo folks review process in order to become a member, and this is a level of standard that equals many of the other benchmarks of quality that we try to achieve in the healthcare industry. And really, it's about the collaboration that will result as a result of this benefit together. There are services as part of this too that we're accessing, and that's more of what Dennis was speaking to. Do I have another question?
I have another one, if I may ask.
Sure, Pat. Go ahead, Pat.
When was the last time Mayo added another center to its clinical care network, and which one was that? And as we go forward, do you have expansion plans to affiliate with other centers?
Thank you. So the question is, when was the last Mayo Clinic Care Network member brought on board, and do we have other expansion plans? The most recent one was Heartland Health Systems out of St. Joseph, Missouri. That was about 2 weeks ago that was announced. We have plans.
But I would say, first of all, we passed with flying colors, which I think I really want to make sure we depart. But Mayo is certainly interested in what we're doing in safety, quality, satisfaction, value, growth. What are we doing with our programs for training nurses, medical education, research? It was a comprehensive study, substantial amount of information provided by Shirley, our VP of Quality, and Paula Reichley and her team, who's our Chief Financial Officer. And then it also included more than one site visit to come here and actually see, and most importantly, experience the people that work here. And I think if I say anything that cinched it for us, we certainly felt our metrics looked good, our trends looked good, the trajectory was fine, but when the Mayo staff was able to meet the people on the floors, particularly our physicians and nurses, that was pretty much it. So they took a look at us from head to toe, and our joint commission is child's play compared to what Mayo asked us to do.